mind separate than your body. Everything is connected. So if you're coming in for one problem, we are considering you as a whole. We're taking your mental, emotional symptoms, and we're also taking your physical symptoms as well. So we're just not treating one part of the body. We're not sending you saying, okay, I can only treat your gut, or I can only treat your mental symptoms, and somebody else will treat everything else. We're not doing that. We're treating as a whole, treating you as a whole person, and considering you as a whole person, because everything is connected, right? Mind, body, and soul. So we're just not taking anything separate. Do no harm. Every doctor follows that, I'm sure. So we know our medicine, we know conventional and traditional medicine, so we're trained in not only pharmaceuticals and conventional mainstream medicine, but also naturopathic natural therapies. So we believe in knowing our medicine, knowing conventional medicine, so we can figure out what are the interactions if you're taking a conventional medication, and I'm putting you on a supplement or a nutrient or an herb and there's an interaction. I need to know there's an interaction. I need to know if it's causing you harm. I need to know if it's decreasing the efficacy of your medicine or increasing it. So that's what I mean by do no harm. So know your medicine, know what you're doing. Doctor is a teacher, so you would never go to a naturopath and they'll see you for 30 minutes or 15 minutes and say, you're done, take this, go home. We would never do that. You come in, you talk to us, we will educate you. We'll tell you what's going on with you, why this is going on with you. We'll have a conversation with you. We'll ask you, how's your life? Are you happy? How's your emotional life? How's your work life? What do you expect from your life? What do you expect from this consultation? We take an hour to an hour and a half, the first appointment with our patients. We get to know you, you get to know us. If you don't know me and I don't know you, there's no relationship, there's no trust. So we build that with our patients. So that practitioner-patient relationship also makes us a teacher for you. We teach you about your disease, we teach you about your health, and we teach you about what treatments we offer and what. So we explain things to you. We just don't put something on paper and say, hey, go take this. So we don't do that. And then prevention is the best medicine. I say that because once I make somebody better, I still work with them to make sure their lifestyle is healthy, they're eating okay, they're on the right supplementation, and if they're sick, they're coming back to see me, because prevention is the best medicine, right? If you can prevent something to happen, why would you wait until it actually happens? So for example, if it's allergy season, or if you get sick every fall, then I would have to make sure that I'm supporting your immune system, and your immune system is strong enough so you don't get sick every fall. That's prevention. Right? So I always focus on that. I always work with my patients and see why are they getting these allergies every season? Why are they getting so sick every fall? And they think it's normal, which is not. You shouldn't be getting these allergies every season. You shouldn't get, your system should be strong enough to protect yourself. But once you've been taking so many medications and you've been suppressing your immune system, you kind of make it weak and you say, hey, I need help. And it says, I can't just work on my own, help me. Right? So then you have to take more medication. But what we do is support it, so you can do it by yourself. So once we support it, then I've seen that most of my patients do not get sick that often, and they get better, and they have a better lifestyle, and they feel better. And once you get better, and you are on an optimal level, you're on that level, you feel so much better, mentally and emotionally and physically. You'll feel happy. Everything is related to your mental and emotional health. So if you're physically healthy, you'll feel happy. You'll feel happy in your personal and your professional life as well. So that's what our main goal is. How are we different from other practitioners? So there are a lot of other natural practitioners in town, and I'm sure there are a lot of other natural practitioners everywhere. And I'm not saying that they're all bad or they're all wrong. Everybody has their own medicine or their own therapy that they're expert in. But how are we different from them? That's what I want to focus on. So we do our 4-year pre-med training at George Mason. For that, I had my 4 years of bachelor's and then decided to pursue natural medicine and conventional. Moved to Arizona. There's 6 schools in the US and 2 Canadian schools. So I picked Arizona because I was too tired of the cold in Virginia. So I picked Arizona, went there to Southwest College of Naturopathic Medicine, had my 4 years of naturopathic degree. Then I passed my boards, had an internship there for a year, and decided to move back to Virginia because that's where I belong and my family's here. You always go where your family is, right? So I moved back here. So that's how we are different. We're board certified, we're licensed by American Association of Naturopathic Physicians and American Association of Physicians also. So we're licensed, we're board certified, that's what makes us different. We take our pharmaceutical exams, we take our national therapy and treatment exams, so we are very familiar with it. In most of the states we can also prescribe. We're also working as primary care in most of the states in the West Coast. East Coast is not there yet, but we're hoping that soon we will be there. Conditions treated. So that's something that's tricky. I hear